talk about what's happening right now in the aftermath of the dismantlement of USAID in so many of the communities that both of us work with, and not just US foreign aid, but the whole international architecture of foreign assistance really has collapsed in the last couple of years, with European countries, who are the other major contributors, diverting foreign aid to remilitarization of those communities, and then, of course, the Trump administration in January very abruptly and very harmfully just destroying that whole system. I'm wondering, want to hear whatever you have to say, but also I wanted to ask you specifically, Leymah, what are you seeing in the communities where you work about, what are women doing? How are they responding to that crisis, because it is very acute?
Let me say something, Yifat. In most of the communities that we work in, the work that these women do at the grassroots level is not tied to funding. It is their life. It is their lifeline. It's their insurance policy. What funding does for them, it makes it a bit easier. But with or without funding, they still have to wake up in the morning and do some of the things that they do. They still have to wake up in the morning and go from community to community, whether it's to create awareness about girls' education or to create awareness about harmful practices, because they know that without this kind of intervention, their community will not thrive. But what we're also seeing now is that there are so many national-based organizations, so organizations that are working in the capital city, pairing themselves up with organizations that are working in rural communities. So there's this kind of partnership that is happening, where you see one group who probably has $50,000 to do small work, going into communities and looking for women's organizations that are doing similar work, and they're saying to them, let's partner, let's help you do what we can do, but also let's teach you on how to raise money from local means or other things. But it's not stopping. Several years ago, I was in Congo, way before all of this, and Julienne Lusenge, who is Sofa Padi and Fund for Congolese Women, she has something called Fund for Congolese Women. And as we're in Congo, Julienne will go from place to place to place, like collecting from $100 to $50 to $75, sometimes $10 from people. And she's putting it in this fund. And she's saying to me, this is how we raise money for these women to do the kind of work that they're doing in the community. And in those communities, they were not even just serving the needs of women. Men who were being sexually assaulted were being helped by these women. What they were doing was asking people who had clinics to give them one room. And in that one room, they will buy their own medication, have their own physician assistants sit there and cater to some of the needs that the clinic could not cater to. And we see more of those things happening today in many communities. I think when USAID folded, it was also a moment that turned into a movement, because now we're seeing that. I'll give an example. Our Liberian government depended on US aid for $250,000 to distribute medication in rural communities. $250,000. This is a country that is rich in diamond, gold, rubber, timber, iron ore. We hold 43% of the forest reserve within the Mano River Basin. That is cash. But we still depended on the US government for $250,000 to distribute drugs in rural communities. The moment that money was cut off, we started mobilizing small organizations to go back to the Health Committee of Senate to say, the government must do this. Today, they included that in the budget, that they will handle it. So there's a lot of advocacy. So out of bad can come some good, and even though it's not where we want to see it, but I think I have two minds with the folding of US aid. It's time for African governments to stand up. Some of the funds that we're receiving in our countries, for example, the US government gave $25 million every year to Liberia for maternal health. But this $25 million, no one knows where it goes to, because we're still seeing women giving birth and they're being incarcerated in the hospitals because they can't pay. And not private hospitals, government hospitals. So all of these monies, some of it, yes, they were going to the right place, but others were not going to the right place. Recently in LA, Nicola Christoph was talking about a clinic in South Sudan, way out in the forest, that was built by USAID money, $1 million a year. And when they cut funding, people were crying. Have you been to Juba? Have you seen the cars that the officials ride? The latest model of different SUVs parked. Range Rover, they have a thing for Range Rover in South Sudan. So imagine if you're taking 20 of those Range Rovers and saying we will not buy these and we'll put it into maternal health issue. So even as we're upset that in some places medications are being spoiled, destroyed, and everything, but this is a moment for us to turn it into a movement to challenge some of our governments in Africa to say, do good by your people. Spend some of the money, and activists in most of these communities are not doing it. But again, with or without USAID money, and you know, Yifat, that many of these organizations were saying to staff, let's rotate. People were saying, I would take salary cut. I was blessed, I am blessed to be one of those that Melinda asked to give out $20 million. So over the last few months, we've had a tedious task of giving money to organizations and having women call to say, thank you. Without this 25,000, we're going to fold. Without this 10,000, we're not going to be able to do some of the work that we're doing. So people are rearranging, realigning, doing all of the reading for their budgets, but they are not giving up, because the moment that we find ourselves in is not a moment to give up, with or without cash. I always tell people we started the movement in Liberia with $10 US from someone's handbag. When we didn't have money for water, we fasted. When we didn't have money for transportation, we walked. When we didn't have money for hotel, we slept in one room. So when the movement calls for painful adjustment, you have to adjust. Yeah.
Yeah, thank you. I don't know if other people have seen this statistic from UN Women, but they came out with a report about 4 months ago. So about 6 months after the USAID big cuts happened in January, saying that more than half of all women's organizations in crisis settings in the world were in danger of being shut down because of the dynamics that you're describing. So the harm is real, and it's sometimes like can really like just stretch our capacity to hold two contradictory things at once, right? Which is like a really important skill to have for moments like this, but it is hard to do. To really account for the amount of harm and human suffering that was caused by those decisions, the callousness of that policy, and the real destruction that we're seeing in lives and health all around the world. And at the same time, the sense of possibility that emerges from that collapse, right? Like you're saying, Leymah, of what if this is an opportunity to actually hold our own governments accountable? Because actually, it is not the job of these little women's organizations to ensure maternal health. That is the job of everybody's government. And many of our governments, certainly our government right now, but even past US administrations, have abdicated that right, that obligation to everybody's social and economic rights, maternal health included. So I think that we need to do a few things at once, right? One is to kind of like celebrate and support the capacity of organizations that are saying, USAID is gone, we're going to step in. We're going to partner with this little local group out in the countryside and make this happen. That is excellent and important to support. We're going to hold our government to account. That work needs to be supported. But we need to be able to pair the kind of micro of people at the local level doing that with the sort of macro level conditionalities that are shaping the circumstances that everybody's operating in. Because why are governments in Africa not investing in their people's public health? You illustrated the issue of corruption, right? So that's real in many parts of the world. And so is the economic realities that those countries have been in since independence from colonization, which is a kind of a forced policy agenda forced by the Washington Consensus and by lenders in Europe that prevents governments from investing in public health and infrastructure and job training and other things for their own people, and has made them dependent on things like foreign assistance from Europe or USAID in the case of the United States. So all of that was like a system that was intentionally put into place. So there is both, I think, like danger and opportunity for us in this moment as that system is collapsing. And one of the things that we're seeing a lot of is new conversations about what it's going to take to finance the kind of local community work that most women do. Right? Most women in the world organize at the local level, like right outside their house, basically. And there's a tremendous amount of benefit in terms of health and education and agriculture and climate stabilization and all kinds of benefits to the society from women getting together at the local level and organizing for those things. But there is a very real question about financing that work. Like you were saying, you didn't have money to fill a gas tank, you have to walk. And so there is a trend right now that I think is a very positive one emerging from this pretty bleak moment of people thinking and rethinking about what it means to finance work outside of government aid, outside of philanthropy, at least the kind of private philanthropy that flows in large dollar amounts from the global north to the global south, which is what many of us think of as philanthropy, right? And so people are both excavating models of organizing and financing work that everybody relied on before we built up this giant nonprofit industrial complex in the US and foreign aid architecture all around the world, right? People have always organized with and for their communities. People have always organized to end their own oppressions in different ways. So that part is not new. And that part will continue because people are people and they are resilient and they are determined to live with freedom and dignity no matter where they are. So the organizing will continue. The question of how we finance the organizing needs to shift right now.